Welcome to Soroti University. This is our pathology lab. Now, basically, pathology is a science that deals about the causes and effects of disease. And pathology basically is that branch of medicine that handles laboratory examination of body specimen, body fluids, majorly for diagnostic and forensic purposes. Now, what happens here is that for the 2 to 3 years that the university has functionally been in operation, this lab basically serves the areas of eastern Uganda, that is the eastern region, and then some parts of the northeastern part of the country. So what we do here basically is to teach students, and then also we have extended services to the community in terms of diagnosis. We've created awareness majorly on cervical cancer and breast cancer. And we're also here to stress out to the public that what is important, especially if you're a girl child, to know how to self-examine yourself, especially when it comes to the issues of breasts. That is an aim of. This is all because we want to try and find out ways of early detection of breast cancer. Once more, my name is Valentine Achulet. I work as a laboratory technician right here at the Pathology Lab of Soroti University. Now, we are inside the lab, and I would want to interest you at one of the sections of the lab. That is the grossing section. This is an area where we barely examine an organ. This is where we examine samples, prepare them, look at them macroscopically using our eyes, to look out for ailments, for lumps, for example, breasts. We look at those tissues that have pathological problems, and this is where we cut them out to make them into sections. So this is the area where we do that from. So once we are done with this, it's a process. We are yet going to another process, another section where these tissues are processed. After the processing is done, I'll take you to a section where these tissues are embedded into a medium. This is a medium. This is a medium that holds the tissue section to enable us section it into thin microscopic sections so that we are able to examine it on a microscope. Still, the medium used for embedding this tissue basically makes sure that the tissue remains in its original form. The cells are viable and are not affected. Yes, so after that, we stain the slide and then head with it to the microscopy section where we are able to see what is wrong with the tissue and thereafter come up with a report. That is what we call full diagnosis. When grossing is done, we come up with small tissues which are actually embedded into cassettes. They are put in a cassette, and then this section majorly here is an embedding. This is an embedding section. We have the paraffin wax put inside there. It is melted, of course. So once I have my tissue on this cassette, I'm able to embed it onto this wax. Now, earlier on, I told you that the reason as to why we embed is to make sure that the tissue gets held up in the cassette for easy sectioning. By sectioning, I mean cutting out these tissues into small sections, very microscopic sections, that can enable us to see through, to look at them on a microscope. So once you're done with embedding, you come to the cooling station right here. So the purpose of this is to keep the paraffin wax, what you've embedded here, to keep it cold, so that the time when you're sectioning, you're able to come up with clear-cut sections, okay? So this is the equipment. This is what we use for that. So on that side, we have the archival. That is where we keep the slides. It is basically a cupboard, in other words. It is an archival where we keep the slides that we've generated. I'm here with my tissue block. This is an area where we now cut out thin sections, okay? This is a microtome, and right here I have my float-out water bath, and then I have these heating blocks. So I am dealing with candle wax, so I need to have something warm to melt it up, Like I told you, this is a paraffin wax. I also need it cooled so that I'm able to cut out clear-cut sections for microscopy. So this equipment does that for me. So at the same point here, this is where I make slides, okay? After cutting out a thin section from here, I put it here on the float-out water bath, and I'm able to make slides out of this. Once the slides are made, I dry them a little bit and bring them to the staining area. It's quite a process. We subject this slide to variable concentrations of alcohol and then subject them to different stains. Right here I have the hematoxylin and eosin, which is basic for pathological staining. And then the outcome generally looks like this, okay? Once the staining is done, I have the DPX here, which is a mountant. This is the outcome of my slide. So from here, I head to microscopy, okay? Let's go right.
I'm just making a follow-up from what Valentine has already explained. Now, in a typical setting, what you see here is what is received from a patient from any hospital. It is a resection or a biopsy from a swelling. Patient has a swelling. So this is what is sent to this lab here. Now, the processes he has taken you through bring us to this level. And then after this level, the final product is this slide you see here, looking reddish. Now, this final product is actually what we put under a microscope here in order to say that patient A has this type of condition. Maybe an infection, maybe cancer, maybe an inflammation, name it. So a surgeon in the hospital will pick this, then send to us here, and then we process it up to this level in order to make a report. Okay? Now, just for the record, Sorority University has the first functional lab, histopathology lab, outside Kampala, from Jinja up to Kotido. So that is the service that we render the community. The university was set out not just to teach, but also to give community service. So the microscope that you see here is multifunctional. We can use it for teaching, because you can see there are 3 observers who use it at the same time. It can also be used for consultation. 3 people use it at the same time. So then to generate a report that is sent back to the hospital for better management of a given patient. Thank you very much.